The culture at Parkview Cancer Institute is something unique in itself, and so we're trying to create something that is inviting, calming, compassionate with our patients and families, in addition to our coworkers. We want to create an environment where a patient walks in and their breath is taken away. It's not done by looks, it's not done by sound, but there's a feeling when you walk in that those around care, and they're very proud for what they do and who they're caring for as well.
Our goal is that everything we're doing is centered around our patient. So as we're making decisions, we think back to what would our patient want us to do. We have some phenomenal nurses and nursing assistants and our physicians. It's all about how can we make it better for them to provide care for our patients so our patients get their very best.
When we first started this process, we were looking at a building and we knew that we needed medical oncology and that we would recruit 8 to 10 general medical oncologists and we would care for patients. That quickly changed as Dr. Sharma came in and truly outlined a vision about disease site specific care. And we quickly changed directions into we need people that are focused on a specific disease.
The Institute model for Parkview is a newer model, and what that means is we've started to subdivide the care through tumor site teams. Each tumor site team is dedicated to a particular type of disease or collection of diseases by anatomy. An example would be lung cancer or breast cancer or colorectal cancer. So instead of giving blanket, generalized care to everyone, we actually take those specialists and put them together in a room oriented around that patient. And that's what the tumor site teams are.
Part of what patients had told us, and we recognized that it's difficult to figure out where to go next and what's happening, and by having our care teams and they can go to one location for their care and see their specialist, a medical oncologist who specializes in their cancer, and a surgeon that specializes in their cancer right there in that same pod. They don't have to travel anywhere else. They can stay right in that exam room in some cases, and the physician comes in and sees them, and then for their next appointment, the next physician comes in, and they haven't had to travel any place. We don't have that anyplace else in our area. That collaboration and that focus on a specific cancer, it means you're seeing physicians that's their specialty. That's where I would want to go.
So we have a tumor site team being evolved for every type of major cancer that we deal with. In addition, they meet on a weekly basis and have a meeting called a tumor board.
That's the setting where the specialists get together and they review each case and talk about what's best for that particular patient.
And that tumor board consists of medical oncology, radiation oncology, imaging, pathology, genetics, dietitian, surgeon, multiple medical oncologists, and we review every case. And so you'll come in, case is presented, all the images are reviewed, pathology is reviewed, providers are there to discuss that, a staging, a diagnosis, and then a treatment is done at that point in time. A tumor board letter is created and then given to the patient after tumor board, and that patient feels comfortable and can see that 20+ individuals just discuss their care. The navigators in the middle of all of this. They're there, truly as their name, to help navigate this journey.
These certified nurse navigators will partner with the patient and their family from the time in which they're diagnosed, ideally within that first 48 hours or almost immediately at the time in which they receive their diagnosis. They participate in every facet of that patient's care. They come to our tumor boards, they go to their first medical oncology appointment, they go to the first radiation oncology appointment.
They are helping with navigating their next clinical exams, helping them schedule the next treatment plans, imaging, social work, logistics, travel, and also being the conduit between all the physicians. So if I'm a patient and I have a concern, I don't have to call Dr. X's office to get that answer. I can go to my navigator, who then will contact the physician or the other physician or the other physician, depending on how many physicians are involved in the care.
What I really like is they really become like friends. The patient knows who they can reach out to, and they really get to know each other. And a bond develops that I just think is so special and just really helps the whole process. When you've got a friend, in essence, that's walking with you through it, it makes it a lot easier to navigate the whole system.
Most people have been touched by cancer, but even those that have not personally been touched are so excited to see what we can offer.
This is important. We want to provide our community with best practice cancer care, and we're going to step up to the plate and really put things in place so that we can do that.
We have such a unique opportunity in Fort Wayne to do something really special.